on acts of criminal acts of abuse and acts of disgusting, callous treatment
and acts of negligence.
The Holocaust is a perfect example. I mean, the Nazi crimes are still just as heinous, and they would still go after anybody who participated in that, even though it was back in that many years ago.
And this is worse because it's America, and America's supposed to stand up for people's rights and freedom. I just want to context this by saying I don't know how many people were victimized under the Pataki administration when George Pataki was governor. That's when we had the problem. And also Antonio Novello was the commissioner of the New York State Department of Health. Now we do have a different governor and a different commissioner, so maybe now is the time where we can make changes. It was just impossible under the former administration to get anything done.
I understand that, and I've heard that too.
We have Dr. Morley here. Dr. Morley, are you there?
I'm here.
Yes. Is there something that, since you're a doctor, you hear all of these horror stories, that you would like to say, to add, or are we just listening and not saying anything? Because maybe it's worthless or it's useless for you to say something. I don't know. What do you feel about it?
Are you a medical doctor?
I am. I am a physician. I've been with the department for a couple of years now. I came from an academic institution to join the department a couple of years ago. The stories are tragic, and I'm well aware that there are tragic stories that are out there. When we look into a very large number of cases every year, it's just not possible to look into every case. So there are assessments that are made when you first hear about a case. And if somebody is accusing, if the accusation relates to a criminal event, it's one that does get the highest priority for us to at least get an initial investigation and collect information and then refer it on if necessary. I'm aware that we do, across the state, we must do about 100 surveys and evaluations per week or per couple of weeks on site, reading the medical records and talking to the care providers. So we do document that many of the things that you're describing have happened in terms of decubitus ulcers and infections and so forth, but it's very rare for us to document that there are criminal events. But occasionally that does happen as well, and when it does, and we're aware of it, we pursue it to the best of our abilities.
At what point does repeated acts of negligence leading to a person's system failure rise to the level of criminal recklessness and negligence?
I think you ask an excellent question, and it's a critical question, but it's one that without having the details, I actually don't have enough.
Well, the details are there, and I believe that this conference is being recorded. Is Merrill going to get a copy of the record that's being made? I have no idea.
Who's recording it?
I mean, I seem to hear some
he's like typing. Like somebody's typing it. And this is Connie again. I had yet to receive written confirmation that we were going to have this conference. That's still.
That's right.
coming.
Well, I'll send you written confirmation that we did have it and sum it up a little bit.
And if there is a record being made of this conference, will the appropriate parties get a copy?
We're not making any record of it.
Oh, you're not?
No.
Okay, sounded like it.
This is Miss Geffner again. I'm making a formal demand to have my father's case reopened. I have all the evidence in black and white. It was woefully ignored. There is no excuse for it.
Well, I think all our cases, I think everyone that's on the line deserves an adequate hearing.
Who was speaking about her father just now?
Ms. Geffner.
Yes, Miss Geffner. You have...
I think you gave me your name before, did you? No.
I think
who am I speaking with now?
Janet Cohn at the Department of Health.
And the gentleman who's the physician with the DOH?
John Morley.
Okay.
Miss Geffner, when did your dad die?
He died in 2004. The nightmare started at St. Francis Hospital, where he should never have even have been admitted in the first place because he just had a minor cough. They wound up infecting him with every virulent nosocomial that you can imagine because they willfully refused to follow universal precautions. No hand washing, no gloving, nothing. He wound up with MRSA, VRA, Pseudomonas, Klebsiella, you name it, he got it. He wound up vented because of that and brutally abused for weeks on end, strapped down like a dog. If they did it to a prisoner or a member of the Taliban, they would bring criminal charges, but not against a sweet, precious, vulnerable man who served his country in World War II.
And so who did you refer this to? Just so I can track it down.
Do you have a number, Rebecca?
I'll get you the complaint numbers.
I don't
He
want...
was subsequently brutally abused at the sister hospital, who calls themselves Mercy, but the true name is Merciless. He had horrific head injuries. He was isolated and chemically restrained in violation of the patient's Bill of Rights, and in violation of Medicare's conditions of participation, 42 CFR 482.13, in blatant violation of the patient's Bill of Rights. He was brutalized for 6 months. We have all the evidence.
I actually, with my mother, I actually brought the patient rights booklet with me, and my mother was held prisoner and was told that she could not, that she was forced to stay there, and they threatened guardianship. And when I showed them the Bill of Rights that she had the right to go home to be with her family, they made threats. They said, you don't want to go there.
Well, I can tell you now, and I'm sure you're eminently familiar with Medicare's conditions of participation. You cannot barbarically restrain a sweet, precious, legally blind, vented man who's on a vent because of malpractice, and chemically restrain him and barricade him and hold him behind barricaded doors and prevent his health care proxy from seeing him. That's what happened, and I am demanding that his case be reopened.
And that's what happened to my mother in a nursing home with the Department of Health fully aware at Suffolk County. I just want to relay to Dr. Morley and Dr. Khan, we do have physicians, and the general consensus is they are afraid to speak out because they're afraid of retaliation. They're afraid that the New York State Department of Health will target them as individuals and basically destroy their careers. So I do have physicians that I speak with on a regular basis.
But you know what? We try to get physicians to help us make the cases that we bring in OPMC. You know, so how could they think, and they testify against these doctors, sometimes powerful doctors, whatever kind of doctors. So how can these physicians think that if they speak out, we're going to persecute them?
Oh, it's not thinking. It's a fact. This is what's happening. I mean, I have numerous doctors that I've invited to join this phone conference, and they're afraid to get too close.
Well, they may be afraid, but that doesn't mean that what they're afraid of has a basis in fact.
Well, what I can do is I can relay your phone number to them, and then if they want to call you as individuals and contact you, because you need to be aware of just how big this problem is so that you can adequately start addressing it.
I'd be more than happy to speak with any of those physicians. We remove the license of 30 or 40 physicians a year because of issues. So we have about 30,000 complaints that come in per year that we investigate or collect some additional information on through the Office of Professional Medical Conduct. If the physicians want to talk to the medical director at the health department, my number is 408-1828.
Okay. 408-1828. And that's area code 518?
Correct.
Okay.
Why do you think, I mean, the very fact that they call it the wall of silence, I mean, is because there's fear.
There's a medical mafia.
There's fear on all sides that people will not come forward.
Maybe some doctors are more afraid of losing their jobs and that they'll be, institution, but
there is definitely a white wall. They refer to it in the police department as the blue wall, and it's referred to in medicine as the white wall. I acknowledge it exists, but it's not because of the health department.
I would like to make a declaration on behalf of both my parents, if that would be okay, just for a minute.
Yes.
All right. I wrote this out because what happened to both my parents not only ruined their lives, but ruined my life and my family as well. So I'm just going to read you what I wrote. The declaration. You know, so much of the time we're just lost. We ask, please God, tell me what to do to obtain justice for the most downtrodden and ignored among our midst, the elderly men and women who